We're back to the third hour of our program. On the line with us is our buddy Alex Lawson, the executive director of SocialSecurityWorks.org and StrengthenSocialSecurity.org. His Twitter handle, ALaw202 or SSWorks. And Alex, welcome back. Tell us about these living increases coming to Social Security and Medicare.
Thanks for having me, Tom. Yeah, I think there's two things that we want to talk about on this. First is the Medicare Part B premiums, which is what people pay every month, and this goes to pay for their Medicare. And you remember last year they went up more than anyone had ever seen because of one single drug, Aduhelm, and this corrupt process where this pharmaceutical corporation basically took over the FDA to push this unsafe drug.
This is the Alzheimer's drug that turns out not to work all that well.
Not only doesn't work, but was really dangerous and caused brain bleeds. So it was removed. But in the meantime, people's premiums had gone way up to cover Aduhelm, which two things. One, that shows just how powerful these pharmaceutical corporations are. One drug, Tom, could have basically raised the premiums on millions of Americans. And then at the time, we said, you got to give that money back because that was wrong. And that is what the president announced yesterday at an event that I was really honored to be at, actually. It was really fun. First time I've ever been to the White House. And he announced that next year, people's Medicare Part B premiums are going to go down, which is extremely rare and really welcome news for millions of seniors getting crushed by high prices by pharmaceutical corporations and across the board, as you know. Well, on one thing, their premiums are coming down. And then just to not get too wonky, but what that really means is their Social Security benefits go up because most of the time, those premiums are paid just directly out of a person's Social Security payment. So that's like step one. That happened yesterday. And then, Tom, next month, in the middle of October, October 13th, they're going to announce the cost of living adjustment for next year. And it will be very large, somewhere between 8 and 10%. So that is really good news for, again, millions of people living on fixed income. That on the one hand, their Medicare Part B premiums are coming down. And on the other hand, their income, their cost of living adjustment is going up. So I think that, it's one of these situations, there's a lot of work to be done, but this is what we told President Biden needed to happen. The money had to get back into the hands of the people. And that's what happened yesterday. That's what was announced.
That is absolutely great news. Now, on the front of Medicare for All, back when Vermont passed their Medicare for All legislation and tried to implement it, they ran smack dab into this wall of that Medicare and Medicaid funding could not go to the state any longer because it has to be attached to individuals rather than the state itself, or at least the Medicare funding. And so there's been this effort to get waivers, and some states have been talking about doing this. Oregon just got a waiver with regard to Medicaid, which is kind of a completely different thing. But I'm not sure what the details of this are. Can you explain to us where we're at generally on federal waivers that would allow states to engage in their own, to put into place their own single-payer healthcare systems, and what's the deal with the Oregon waiver?
Yeah, it's a great question, and there's a lot of really exciting stuff happening. It's just really nerdy, exciting stuff. So reel me in if I go too far into the weeds, Tom. But first off, I would slice Washington, Oregon, and California off into their own sort of bucket in terms of what they're trying to do to provide healthcare to everybody in their state. California just covered everybody in California, regardless of immigration status, everyone over the age of 50. With their Medi-Cal program. They also are sort of dipping their toes into federal Medicare policy from a different angle. And this is what we think as activists needs to happen, is that the states can't just wait for the federal government to give waivers. The states move, they take action, and they have to follow the law. But in some of these cases, it's really clear the state has a lot that they can do, right, within their own power. And then the feds, we have to push the federal government to catch up and provide the waivers that are necessary for these states. And as you know, in Oregon, in Washington, and in California, there's a lot of, I think Oregon has I might get it wrong, but I think a constitutional mandate, a state constitutional mandate now that they have to provide health care in their state. They have to figure out how to do it. So these are sort of, there's two forces. The states are saying we have to figure out how to give our people health care. And the feds, they're not actively opposing it, but they're certainly not helping. So this waiver that they gave to Oregon it's on the smaller side. It's on the Medicaid side, and there's always a lot of waivers being requested and granted. So I don't think that it really plays as much into the state of single payer as, say, the California move to cover people 50 and up. That's huge. Mm-hmm. That's massive, right? And as you talk about all the time, the Saskatchewan model is how Canada got their single payer healthcare system. So if a state like California moves, it basically takes the rest of the country
that's gotten virtually no publicity. I don't think most Americans realize that everybody in California over 50 now has health insurance coverage, and no other state is doing this.
Tom, so first of all, it's really like brand new, but I'm shocked at sort of the lack of information on it as well. California is also moving forward with public production of insulin. I mean, a total game changer. So Governor Newsom is really driving hard at fulfilling these campaign promises. Even when he backpedals on some things, I know in the single payer world, he said he was going to be single payer, and then he added a few buts when he came to office. At the same time, words are words, but providing people health care where the rubber meets the road, it's a big deal. And I think we do need to be looking to California and the states to lead on this issue of providing guaranteed health care, because I don't see Washington, D.C. leading on this. And that means, to just end where you started, these waivers, we're going to have to, pry them out of Washington, D.C.'s fingers, but we need a really bold state actions to get us there. When it's sort of a little wishy-washy from the point of view of the state government, it's really easy for the Fed to just not do anything. Right. But, when you have governors who are driving to get this done and an activated grassroots base, we really have a lot of opportunity. Well,
the big problem, of course, is that, any state that wants to do that, to, create single-payer health care or whatever it may be, is going up against $1 trillion industry that has been empowered by the United States Supreme Court when they blew up our anti-political bribery laws, with Citizens United. So it's a particularly challenging thing. I had a question for you, and it has completely escaped me.
But just on that prompt, Tom, I think one of the things that I like about what I'm seeing in California and at the state level is also some willingness to take on. So yes, when we have a united opponent who has basically unlimited money, it's really difficult to beat them, which is why we have to divide our opponent, right? So in the privatized Medicare space, we want to actually turn them on each other, right? Like, we want to go after the bad actors in Medicare Advantage and actually reform the system as a way of slowing down the privatization, weakening our opposition so that in the future we can just get rid of the privatized Medicare completely and have a single payer system. We want to pursue that at the state level as well. And there's a lot of willingness to do that. So we need to provide people health care. We need to, create our vision. And to do that, we have to take seriously who's on the other side and how much they're willing to spend and throw at defeating us, and be very strategic in dividing them so that we can actually provide health care to people.
Right. I don't know if you knew it, but largely as a result of callers from this program, when they come on the program, Congressmen Ro Khanna and Mark Pocan are working on legislation to forbid insurance companies from calling their private insurance that they offer to people over 65 Medicare, doing away with the Medicare Advantage brand. What do you think?
As they should. You know, as you know, we talk about it all the time. The truth is that traditional Medicare outdoes any private insurance just across the board on every metric. So is traditional Medicare perfect? Absolutely not. We got to add vision, hearing, dental. We got to add a catastrophic cap. But even with all of those deficiencies, which we need to fix, and you know, private insurance takes advantage of the fact that there are those deficiencies. The Medicare Advantage program, it costs more and it delivers less. Right. So we need to chip away at it from all sides because, and unfortunately, the truth is, as you know, and your listeners know, we're losing that battle right now. Yeah. You know, we're at around 51% of the Medicare universe has been privatized,
right.
And
it's past that threshold. So, Alex,
exactly.
Real quick question. I know in the early months of the Biden administration that Social Security and Medicare were still being run by Trump administration holdovers who basically hate Social Security and Medicare. Is that still the case?
No, we sent them packing. That was a really great early indication that President Biden understood the power of these programs. And again, he did it yesterday. He held up Rick Scott's plan, said, this is your plan to cut Social Security and Medicare. You know, it's right here in writing. Yep. He knows that this is an issue that he wants to lean into and just show the Democrats want to expand Social Security. The Republicans want to cut and destroy Social Security. It's as simple as that.
And they've wanted to ever since 1935, you know, when it was rolled out. I mean, they've never been shy about saying so.
Alf Landon ran his entire campaign, the guy who ran against FDR, it was explicitly an anti-Social Security campaign. That was his one issue. He stumped all over the country, and he lost every state but two. No one remembers his name because that's what happens when you come after Social Security.
There you go. Yeah, he was claiming it was communism or socialism. Amazing, amazing. Alex Lawson, socialsecurityworks.org, strengthensocialsecurity.org. Thank you, Alex.
Thanks, Tom.